She has fatigue but is not dizzy, desires to conceive her second child next year, does not smoke, and she, in her past medical history, has type 2 diabetes. Vitals are afebrile, blood pressure 138 by 71, heart rate is 80, BMI is 40.2. So this gets classified as obesity class 3. And on pelvic examination, we find that there is moderate amount of blood in her vaginal vault. And then what do we do next? Of course, because she's in a reproductive age group, we will first and foremost do what? We will do her urine pregnancy test. Especially women in reproductive age, whenever they have abnormal uterine bleeding, always rule out pregnancy. And you can see that Arunima's pregnancy test has come negative. So the next thing is that we have to now see why is she bleeding after her pregnancy test has come negative. So what is the next best approach that you can do for her? Always that you have to first give her hemostatic medicines. We can give her a combination of mefenamic acid and tranexamic acid, because mefenamic acid improves platelet aggregation and degranulation, and therefore it causes hemostatic plugs which are transformed and causes decreased bleeding. Ensure to give it in the right dose. Remember, our Arunima is a little plump, is a little obese, so she will require a good dose of 500 milligram, and she has a tendency of acidity. Then it's always better to give it with a H2 receptor blockers and with food. And then tranexamic acid is known to cause stop heavy menstrual bleeding, because it brings about fibrinolysis and then conversion of plasminogen to plasmin, and it's known to be extremely effective, can be given in the dose of 1 to 2 grams in a day. There are certain red flags which we are going to discuss, but the first line of treatment is try to stop that bleeding, maybe even for a temporary time, but don't allow that woman to bleed and get further exsanguinated. That gives her a whole lot of confidence, and then you can help her with the rest of the things.